So when you're cardiac, what I have said previously, if your cardiac muscles, your body goes to, and like your heart failure goes to decompensated stage, so what will happen? It will further increase that stage. It will worsen this heart failure more, because it creates a vicious circle. So this one can see from this that the failure of cardiac output in arterial pressure to rise the critical level required by function result in progressive rotation of more and more blood, which causes progressive elevation of the mean cerebral rate and progressive elevation of right arterial pressure, until finally the heart is overstretched or so edematous that it cannot pump even moderate quantity of blood and therefore fail completely. Clinically, one detects this serious condition of decompensation by progressing. Like I was in treatment. Okay, I will just go. Sorry, I was in treatment. Edema of lungs, which lead to bubbling, rails or cracking sound in the lungs, and to dyspnea, as I said, lack of appropriate therapy, this rapidly lead to death. So digitalis, I was saying about digitalis. So you are, if your cardiac stage, failure stage, go to decompensated stage. So your strengthening ability of your heart has decreased. So to increase that, the tone of your heart muscles, the contraction ability. So digitalis is the treatment. The heart becomes strong enough to pump adequate quantity of blood required to make the kidney function normally again. Eventually, diuretics drugs to increase kidney excretion, while at the same time reduce water and salt intake, which bring about a balance between fluid intake and output despite low carbs. So what's the treatment? So what's the treatment of this decompensated digitalis? It increase the strength of the heart muscle. Diuretics, it increase the function ability, the filtration ability, kidney excretion ability, and another is what? Diuretics. This is diuretic, okay, and low salt and water intake. Both methods stop the decompensated blood by restoring non-blood brains, so that at least as much blood leave the body as intact. So the kidney is continuously retaining fluid. So and now a balance is required between intake and outtake by your body. So diuretics and less intake of water and balance of water and salt is necessary, and this is the decompensated. So what's the digitalis do? What is mechanism? Cardiogenic drugs such as digital when administered to a person with a healthy heart have little effect on increasing the contractility of the cardiac muscles. When someone has a healthy heart, these digitalis, it has no effect on your heart and your contractile strength of the heart. However, when it's to a person with a chronically frail heart, the same drug can consume increasing our pain as much as 50 to 70 to 100, 50 to 100%. Therefore, they are one of the mainstays of therapy in person with chronic heart pain. Later and other cardiotonic glycosides are believed to strengthen the heart contraction by increasing the quantity of calcium ions in muscle fiber. This effect is likely due to inhibition of sodium potassium adenosine triphosphate in cardiac cell membrane. Inhibition of the sodium potassium pump increases intracellular sodium concentration and slows the sodium calcium exchange pump exclude calcium from the cell in exchange from sodium. Because the sodium calcium exchange pump relies on a high sodium gradient across the cell membrane, accumulation of sodium inside the cell reduces its activity. So what that is to it opens the calcium ion channels, like you will have studied that calcium channels is necessary for muscle fiber contraction, cardiac muscle fiber. Calcium ions are necessary for muscle. So what it is do? It is necessary for contraction. So it opens the calcium channels, and it closes the sodium potassium and triphosphate in cardiac cell membrane. Inhibition of sodium potassium increases intracellular sodium concentration and slow the sodium calcium exchange pump, which exclude calcium from the cell in exchange for sodium. Because the calcium exchange pump release on high sodium across the cell membrane, the accumulation of sodium inside the cell reduces its activity. You will understand it that the sodium potassium pump, it decreases the calcium inside the cell. So by inhibiting these, it increases the calcium inside the cell and it causes more muscle contraction. In failing heart muscle, the sarcoplasmic reticulum fail to accumulate normal quantity of calcium and therefore cannot release enough calcium ion into the free fluid compartment of the muscle fiber to cause full contraction. The effect of digitalis to depress the sodium calcium exchange pump and rise calcium ion in cardiac muscle provide extra calcium needed to increase the muscle contractile. Therefore, it is usually beneficial to depress the calcium pumping mechanism a moderate amount using digitalis, allowing the muscle fiber intracellular calcium level to rise slightly. Okay, so it sodium and calcium exchange, it stops sodium calcium exchange channel, and in this way it increases the inside calcium ion level. Now we are going to do types of heart failure: unilateral and bilateral, left heart, right heart. Well, how much we have left? 2, 3, 4, 5, 6, 7. Oh, much. Left heart failure, low output cardiac failure, cardiac edema in patient with cardiac failure, long-term fluid retention by kidney causes edema and resisting failure, or is productive in every delaying of cardiac acute pulmonary edema late stage. Cardiac reserve, we will study cardiac reserve quantitative graphical limited power analysis of cardiac failure. Acute heart failure and chronic compensation, sympathetic pressurized cardiac output, venous return compensation during the next few days for increased cardiac. Oh my god, because of decompensated cardiac failure, treatment of decompensated heart failure with digitalis. Now we have studies. At high output cardiac failure, venous fistula. Ooh, so unilateral, we study unilateral, and then we will go to low cardiac failure and cardiac failure, low output cardiac failure, high output cardiac failure, like biri biri vaira. And then we will go to it. So this is enough for today. So see you later in another lecture. Bye bye.